My name is Daisha Wall. I am the Director of Programs and Impact at Clean Air NC. So I oversee our statewide environmental justice, community science, health program, and advocacy programs, just making sure that our program managers and our programs themselves are supporting the communities most affected by pollution. So a big part of my role is managing our air monitoring networks across North Carolina with our community science manager and helping to translate that data into information that community members, policymakers, and agencies can actually use and understand. So prior to this role, I was the first environmental justice program manager for Clean Air, where I mostly partnered with impacted communities across the state. And then I transitioned into our community science role before I became a director. So in that role, mostly yeah, deploying those air quality sensors across the state, mostly in Black and Brown low-income communities that are being disproportionately exposed, whether by sources of air pollution, whether that's industry, highways, wood pellet facilities, concentrated animal feeding operations. So that program is really what brought us to Ghana through the Mandela Washington Fellowship Program, which is actually administered by IREX. It's called IREX. And the funding is provided through the US government through the Department of State. So we had a fellow, her name was Huda Ibrahim, and she was with Clean Air for about 6 months. So she's from Ghana. She works for the Ghana Environmental Protection Authority down there, and she was part of this program, came with Clean Air. She helped us a lot with like our data quality, data analysis. She helped to automate some of our reports that we give out to community members every month. And so after she left, she reached out to us and said that there's an opportunity for a reciprocal exchange program through the Mandela Washington ship. So that is how we got this opportunity through our fellow Huda. So she came and stayed with us. So we then went and supported her and her work. So before I get into exactly what we did, do you have any questions about any of that?
No, I think that pretty much lays everything out in terms of the how and how everything unfolded that way. It was interesting, though, to learn that the U.S. government participated in this, considering the political climate right now, and where there's still some connectivity between the U.S. government and environmental concerns. I'm just uh,
Yeah.
overwhelmed to hear that.
I will say we were too. And we actually found out while we were in Ghana that they were not providing funding for next year. So while we were there, I don't really know what the status is right now of that program, but while we were there, we did get notification that they kind of scrapped next year's reciprocal programs. So we just made the cut, pretty much. And we actually applied earlier in the year, and we found out in February that we didn't get it. They said that our project was really strong, but they had really, really good projects. But they encouraged us to apply again. So we applied again and we got it. So yeah, that's how we got here. So yeah, leading up to the process, we wanted to make sure that the project would be as sustainable, applicable, culturally responsive as possible, and that we were making the most impact. So we didn't want to just focus on air quality monitoring. We actually extended a lot of branches in this 2-week project into health and education. But from the monitoring standpoint and why they wanted us to go over there is because in Ghana, there are not many reference stations like we have here in the United States. So the reference stations are the ones that are operated by the government. Those are the monitors that they use to essentially understand whether, a region or an area is falling under compliance. And those standards are set usually in the United States by the EPA. In Ghana, it's the same thing by the Environmental Protection Authority, and those standards are set in order to, advise on health and just make sure that people are not being overexposed. But across the regions of Ghana, they only have, I believe it was about 4 reference stations, and only 2 of those were actually being operated by the government itself. So there is a huge lack of understanding, of how air pollution not only moves throughout the country, but how it's affecting, certain populations, especially populations in Ghana who are particularly affected by Harmattan season, which is a season that happens in Ghana, typically around November to March, and it's where all the dust comes in from the Sahara. And then there's also issues around dust just from a lot of the roads not being paved, and so the dust is being kicked up. Residents also burn a lot. There's not like landfills and people don't bring their trash to the front of their house like they do here where a dedicated person comes and picks up their trash. So a lot of residents burn their trash in their front yards, and it's actually mostly kids that do this. And so and then the last major air quality concern that we heard from was it was called galamsey, which is essentially like illegal mining that a lot of residents participate in, and it's causing a lot of environmental air quality issues. So those were kind of the air quality issues that served as a platform for us, coming and providing some data and some resources to help fill in the gaps of how all of these air quality sources are affecting, particularly this region in Ghana. This area we were in was called Techiman. So yeah, that is where we went. We spent some time in Accra with the main EPA heads, and then we moved down to Techiman where we spent most of our time. And once we got there, we deployed 7 purple air monitors, which are monitors that do require Wi-Fi and power. So those ones were a little bit harder to connect that we found. And then we also deployed 3 air note sensors, which are solar powered and LTE enabled.
Mhm.
So we made sure to prioritize those in areas like the hospital. We put one at the market area, and then we put the other one at a school. And then while we were also doing all of those deployments of those sensors, we gave the staff mobile air beam monitors, which are just mobile sensors that you can walk around with. So we did all of those deployments. Those are now up and going. And after we did those deployments, we held an 8 hour long training with EPA officials about how to maintain these sensors, how to collect the data, how to analyze it, how to report back to the community, different, entities that they could connect with who is doing relevant research around air quality, such as the Contampo Health Research Center, who prior to when we came in, they were not connected with them, and they actually operate one of those reference stations that I was speaking about earlier. So they now have a really good connection with the Contampo Health Research Center. They're working together to create a correction factor for the data to make sure that the data quality is really sound. So that was the air quality monitoring portion of the grant. We also attended a school and did like a 2 hour session with students to talk about air quality. There was about 100 students there. We did some activities, and that was more of like a fun day for us just to connect with the kids. And they were extremely, extremely well versed about air quality issues. And I don't know whether that's an educational thing or just the fact that they themselves, can see and visualize and feel the effects of air pollution in their communities. Like I mentioned earlier, the kids are a lot of the times the ones that are like burning, this trash and participating in illegal mining and all that stuff. So I think the kids are very connected to those issues. But that was just like a really fun day. But how we ended it off is we actually held another 8 hour long training for health officials in the region. So there was over, I believe we had about 44 nurses, doctors, health representatives that worked at local hospitals in this area where we deployed the sensors. So they could basically understand how air quality impacts patient health. And we have continued to hear from those doctors and nurses who have gone on to educate others in their centers. And yeah, like I said, the session examined the connections between air pollution, respiratory and cardiovascular and maternal health, and included guidance on integrating environmental risk awareness into patient care. So we actually, like I mentioned, we coordinated a lot of partners before we went, and we connected with a director of a health center down in the region who actually helped to lead that healthcare training. And his name is Dr. Joel Alfie Dua. And so he actually was a part of the Mandela program as well, for a whole separate project. But yeah, That's kind of the gist of what we did and the impact we're making. Of course, we will continue this partnership. We'll have ongoing coordination with Ghana EPA and the Kentampo Health Research Center. There's potential opportunities for future health modules that could be integrated into our learning systems. The EPA is continuing school engagement, and there's also opportunities to integrate data storytelling tools through Clean Air's educational platforms. And so we also want to talk about this at our annual NC Breathe conference. We'd love to have some of those doctors and nurses that attended those sessions, maybe try to sponsor them to come out to our conference, is something that we've been talking about. But yeah, the main goal, the immediate impact was, of course, the expanded monitoring infrastructure, strengthening those institutional relationships, and improving the technical capacity across, the government, health, and educational sectors in the Techiman area.
How much of a challenge what is that uh, when you talk about the lack of roads, and it may not necessarily be as urban as, let's say, Charlotte or the
Yeah.
US is. How much of a challenge do these folks in Ghana face when it comes to getting a handle on the data and then transferring that knowledge into workable solutions?
That's a great question. It was a huge challenge, especially deploying those sensors that required Wi-Fi. But we were very quick on our feet. We ended up employing, while we were down there, a local electrician who helped us because some places the internet wouldn't reach as far. And so about 3 sites, we had to hire them where he cut the cord and he connected it to like an existing wire system in the home so it could, be placed in certain areas where it could reach Wi-Fi. So we immediately recognized that at our first deployment, that being in this rural setting with not as much access to the things that we have access here to, it is extremely difficult. And so, I think just in terms of the prowess or, the ability to kind of take those things to the next steps. I think in those issues that we came up across just in deployments, the EPA was really fast on their feet to come up with solutions. And, even with those barriers, we ended up deploying all of the sensors. And now they have the training on how to, um, analyze that data, but I will say it's going to be a long road, mostly because standards are so different. So in the United States, there's some debate now because the Trump administration is trying to strike down this rule, but there was a rule made last year to decrease our exposure for particle pollution or particulate matter, which is mostly what we measure, from 12 micrograms per cubic meter to 9. And that was a, decision made to save lives. Essentially, they had estimated that it would save thousands of lives a year because air quality is one of the leading causes of death globally, as well as in the United States. So ours is 9. In Ghana, it's 35. That's their annual standard. So it's a lot higher. And so with that, there's going to be challenges in terms of seeing the reduced health risks because even if these sensors are showing, that they're staying under attainment of that 35 micrograms per cubic meter, that is still an insanely high number that should be lowered to protect health. And so that is going to be I would say the biggest challenge is using this data to lower those standards for, the whole country or for certain regions that are being particularly really impacted by dust exposure or other sources of air pollution. But I will say the EPA seems very, determined. They seem really excited, and now they actually have the baseline data to start moving towards those things and having the data to show that these levels are too high or we're having, exacerbated levels. We're seeing seasonal trends here. So the data is going to help, facilitate those conversations. And we're actually sending them more sensors. So those solar sensors, we're sending them 10 more. So they'll get even more, just area of coverage to help inform those decisions.
Considering your work has primarily been in North Carolina,
Mhm.
USA,
Mhm.
and working in communities of color,
Mhm.
what was the impact on it for you to go to Ghana in Africa, where there's plenty of people of color, and the impact, seeing your work and your teaching and how that impacts folks who, from just the sound of it, they are quite a ways behind the U.S. in terms of air quality and
Yeah.
pollution control.
Yeah, that's a great question. I love that question. So, from a personal standpoint, just taking work out of it, obviously, I'm a Black woman, African American. I have always wanted to make it to any country in Africa in particular, but Ghana in particular was just such an exciting opportunity for me just to be able to connect with you know, the homeland essentially. And I have a lot of ancestry from Ghana. And so that was just a really cool experience for me. And, I recognize it's a once in a lifetime opportunity. Like some people don't even make it out of the country. So, from a personal standpoint, super exciting. But also, I will say it made me recognize my privilege a lot more. And yeah, it was interesting kind of navigating through cultural differences. I didn't feel it felt really cool like being surrounded by people that look like me and I'm usually, especially as a Black woman in the environmental space, I'm usually the only person like in a room. And so being around all of these people, it was really incredible. But yeah, I mean, in terms of just the perspective of how different it was between the US and Ghana, I think that there's just a lot of opportunity. There's things that we know that they don't, but there's also things that they know that we don't. And so being able to collaborate effectively in that way and using their knowledge on the ground, actually put some things in my mind that we need to have available here when we're out in the field doing deployments and things that might come up. Like they helped me in my process as well, kind of figuring out yeah, just navigating through kind of the difficulties that come in deployments, as well as it kind of allowed me to kind of dive deeper into like data correction factors and how to create sort of, what are the processes we need to make to have appropriate correction equations for their region. So there was a lot of opportunity just for co-learning. But yeah, I think I'm kind of like yapping at this point. Did that answer your question?
Sure does.
Okay.
Sure
Cool.
does. Because one of the things that I've noticed in reporting on the environment here in Charlotte, in North Carolina for that matter, is that a lot of times, there's the stereotype of the tree hugging, long hair, usually white person who's all into the environment, and Black folks don't really go into that space. At least that's the stereotype.
Yeah.
But is part of your work here in the States to help dispel that? Because we're all breathing the same air. We're using basically the same water. It's our environment. And if a wildfire happens in Canada, we're going to breathe it too. Is that part of what your work entails in dispelling those myths that the environment and caring for it is not white folks' job, it's everybody, including Black people?
Yeah, absolutely. And I feel like I dispel that just in my presence alone. But I will say, the environmental space should not be limited to just, a certain race or even a certain level of education. And that's something that I'm working to dispel in my role specifically is that specifically with like we work with a lot of partners, so like universities, agencies. I sit on the governor's environmental justice advisory council, so I work with a lot of state agencies as well, and like the governor's office. And so I have to put on all of these different hats. And in these spaces, often, they think that you have the PhD and you're the person that I should be looking to find the answer for this because your experience and, your education or even, your race or your perception of your race. But what I'm trying to dispel is that if you're looking for the answers and you're looking to solve these issues, especially when it comes to environmental justice, you need to be in community and you need to listen to the people that live there because they are the experts of their lived experience and they are a huge piece of the puzzle. So it's not only, like I said, dispelling that Black people belong in this space, but also that, people of color, Black and brown people, low income communities who are actually being affected by these issues hold the key to solving these issues. And it's not the person with the PhD at, Duke University. They're a part of the solution, but they're not, the panacea to getting to our goal. We all have to work collaboratively and lean in on those voices, even if, they don't have the research background or whatever, that people are looking for. So
Yeah,
I think most of my work mostly, leans on that and trusting community and leaning on community, not leaning on them, but, trusting and using their voice in the solutions that we're trying to get to.
yeah, because no one group has the answer to everything.
Yeah.
And even to that end, in just covering how the environment and climate change impacts Charlotte, we've been covering things like uh, trees and how certain neighborhoods have these tree-lined streets and they're always cooler and it's a better situation. And then if you go to other neighborhoods where there's more asphalt, fewer trees, fewer shrubs, sunlight is bouncing off the asphalt, and it's a cooker.
Yeah.
And how people don't necessarily connect all that in terms of how the environment impacts health and the dire consequences of when you don't have enough of that infrastructure and that natural barriers to these poor conditions.
Exactly. And I think a lot of those connections started to be made clear a little bit more during COVID, but we still have so much more work to go. But I was not happy to see this, but I was grateful to see the connections being made between the communities that were being, disproportionately dying from the virus, which were mostly Black and brown communities. Those were the same communities that were being overexposed to sources of PM 2.5 or particulate matter. And so this connection started to be made that, like, oh, these communities who are consistently facing exposure from air quality, so they have maybe poor lung health, are also dying from this respiratory virus. So I think a lot of connections started to be made. And then, there was conversations about, oh, well, asthma is also like one of the leading causes of missed school days with our children. The students who are missing the most school also live in these communities who are being overexposed by sources of air pollution. That might be triggering their asthma and that might be triggering why they're missing school. And then it's a larger issue. That student gets held back. They're not, in their learning space. And so it's more than just, like you said, being, exposed to these things or not having access to these things. It's a it's a trickle down effect. And the system, I always say, is working exactly how it's supposed to be. This was all set up through redlining and segregation and racism. And so that is the intent. But it's on us to use our voice and, continue to provide resources and support these communities and telling their stories and getting those solutions.
Yeah. Uh, One other question. How long were you in Ghana?
2 weeks.
2 weeks.
Yeah.
You put in all that work in 2 weeks?
Yeah. And over 30 hours in the car.
Oh my. Okay. Well, but obviously it was uh, satisfying, gratifying experience for you. Would you like to expand on that and maybe go back to Ghana or another part of Africa or some other place internationally?
Um, well, I did travel internationally to Paris earlier this year for work as well. Not, I was just speaking at a conference, so it wasn't as fun. But yeah, we want to continue. I would just say from this international perspective, our focus is always North Carolina, but when we get these opportunities, we're really grateful. Our deputy director went to Bolivia a couple years ago through the same program, so we definitely want to continue to, do this program if it's available and have, students or fellows come in, be placed with clean air, and then, do the reciprocal exchange. And it doesn't always have to do with air quality. So our deputy director, he's was mostly doing like HR work. And so he went and supported like the HR team like down there in Bolivia. So it's not always directly environmental, but just like sharing our knowledge and our resources, I think in general is something that, especially in the current climate, as things are getting removed, access is getting removed, is something that we're really heavily focused on. And it just makes me feel really grateful for what we've built, that people are consistently seeking, our process and our knowledge and how we connect with communities through air quality monitoring. We get so many inquiries from all across like the United States, but now sometimes across the world of people wanting to get more insight into our program because it's so successful. Because clearly we are connecting in the right way. And so I'm just really, really proud of our team and yeah, hope for more opportunities like this in the future.
Imagine that. North Carolina showing the way.
You talked about the environmental field and dispelling some of those things. It can be very competitive, and sometimes we work apart rather than together. And so we're really trying to also encourage collaboration right now. We have to stick together right now. So,
Okay. All right. Well, I do appreciate you taking the time to talk to me, and obviously great work and necessary work. And I appreciate you taking the time to share your experience